All right, let's talk about something we all do, something that can be a little embarrassing, but is actually way more interesting than you think. I'm talking about the burp. Today, we're going to peel back the layers on this thing, which doctors call eructation, and you're going to see it's not just some random noise, it's this incredibly complex biological process.
So what's the deal with a burp really? Is it just a simple little reflex, or is it something more, like a finely tuned symphony going on inside your body, with a bunch of different parts all working together at the perfect time? Well, as you're about to see, the answer is way more complicated than you probably imagine.
So get this. This number, 10 to 30, that's how many times the average person burps, every single day. That's right, it's not just normal, it's absolutely vital. Think of it like a critical pressure release valve that your body has to have to keep things running smoothly.
So here's our game plan for today. First, we're going to break down the anatomy of a totally normal, healthy belch. Then, we'll get into the difference between what's called gastric and supragastric belching. After that, we'll dive into the pretty awful no burp syndrome. And finally, we'll look at the incredible way doctors can actually fix a broken burp reflex. Okay, let's jump right into part 1. Seriously, forget everything you thought you knew. A normal burp isn't just a puff of air. It's more like a sophisticated 3-act play, and your nervous system is the director. We're going to break down the exact mechanics of this journey, step by step.
To really get this journey, you need to meet the gatekeepers. Your digestive highway has these two powerful muscular rings, or sphincters. Just think of them as two high-pressure security guards, the lower esophageal sphincter, or LES, at the bottom, and the upper esophageal sphincter, UES, at the top. Their main job is to control what goes down and, as we're about to see, what comes back up.
First up, we've got the LES. This guy is the crucial barrier between your esophagus and your stomach. It's normally clamped shut tight to keep all that stomach acid where it belongs. For a burp to even begin, the gas has to get past this first, very tough guard.
And then you've got the UES, our final gatekeeper, sitting at the very top of the esophagus. When you swallow, it opens up for food to go down, but for a burp to get out, it has to get the signal to relax and let the air out.
Now this is where it gets really cool. The whole thing happens in 3 completely separate phases. It's not just one event, it's a sequence. First, the gas has to escape the stomach. Second, that top barrier has to be taken out of the way. And third, the gas needs to be actively pushed out.
So it all starts down in the stomach. Maybe you swallowed some air while eating or you had a fizzy drink. Either way, gas starts to build up. This buildup makes the stomach wall literally stretch out. That physical stretching is the trigger. It's like hitting an alarm bell that sends a signal all the way up to your brainstem saying, hey, we need some pressure relief down here.
Your brainstem gets that message loud and clear, and it shoots a command back down through something called the vagus nerve, which is basically the superhighway connecting your brain and your gut. The command triggers what's called a transient lower esophageal sphincter relaxation, or TLESR. All that means is that the first guard, the LES, is told to just chill out for a few seconds. That opens the gate and lets the trapped gas vent into the esophagus. Okay, so now the bubble of gas is in the esophagus, and it starts to travel up. As it rises, it pushes on the walls of the esophagus, and that triggers phase 2. A signal goes to the UES, that top gatekeeper, telling it to relax and open up. But here's the brilliant part. At that exact same moment, other reflexes kick in to seal off your airway. It's an amazing bit of coordination to make sure the gas goes out your mouth and not down into your lungs. And finally, for the grand finale, the gas doesn't just float out on its own. Nope. The esophagus actively shoves it out. It uses these reverse waves of muscle contractions, the total opposite of what it does when you swallow, to propel that gas bubble up and out through the now open UES. And just like that, the eructation is complete. A perfect 3-act symphony.
Okay, so that's a perfect burp. But what happens when that symphony goes completely off-key? Well, that brings us to our next section. Because when someone is belching excessively, it's not always the same thing. Doctors now know there are 2 fundamentally different types, and it all depends on where the air is coming from.
But before we get into the types, you should know that burping a lot is often just a symptom, not the root problem. It can be a big clue for things like GERD or functional dyspepsia. It can even be caused by stuff like poorly fitting dentures or CPAP machines, because both of those can make you swallow way too much air, which is a condition called aerophagia. So the first type is what we call gastric belching. This is pretty much the normal process we just described, but it's just happening way too often. The air comes from the stomach, and it's a true involuntary reflex to relieve pressure.
It's basically the body's pressure valve working overtime.
Now for the second type, and this one is a whole different ballgame. This is supragastric belching, and the name tells you everything. Supragastric means above the stomach, and that is the absolute key. This is actually a behavioral thing where a person sucks or pushes air into their esophagus, but it never even makes it to the stomach. It's just expelled right away.
So you might be wondering, how does somebody even do that? Well, there are two main ways, and often the person doesn't even know they're doing it. There's the suction method, where they use their diaphragm to create a vacuum that sucks air in. And there's the injection method, where they use muscles in their throat to literally push air down. Either way, it's an active, physical habit.
Let's just break down the key differences here, because they're huge. A gastric belch, gas from the stomach, it's an involuntary reflex. Supragastric, air from the outside. It's a learned behavior. And look at the frequency. A normal burp is occasional. A supragastric one can happen up to 20 times a minute. But maybe the biggest telltale sign of all? Because it's a behavior, supragastric belching completely disappears when the person is asleep.
All right, we've talked about burping too much. Let's pivot and talk about the complete, dramatic, and often miserable opposite. Can you imagine a world where that essential pressure relief valve is just locked shut? Let's explore this strange and debilitating condition of being physically unable to burp.
And to really get how big of a deal this is, just listen to what these folks go through. This is not some minor thing. The trapped air causes these constant, loud, gurgling sounds from their neck and chest. It leads to painful bloating, serious chest pressure, and a lot of times, really significant social anxiety. It's a daily, painful struggle.
The official medical name for this is retrograde cricopharyngealis dysfunction, or RCPD. And get this, it was only really identified and named back in 2019. The whole problem comes down to that upper gatekeeper muscle we talked about, the cricopharyngealis. It just will not relax to let air move in the retrograde or upward direction.
And the symptoms make perfect sense when you think about it. Since you can't burp, the trapped air causes those gurgling noises in your chest. All that trapped air also leads to painful bloating and pressure. And well, if the air can't go up, it has to go down, which leads to a lot of excessive flatulence.
And here's the central mystery of RCPD. That UES muscle works perfectly fine in one direction. It opens up every single time you need to swallow food or drink, no problem. But when it comes to letting gas escape upwards, nothing. It just refuses to relax.
So, how in the world do you fix a muscle that just won't relax? Well, this brings us to our final section, and it's a pretty amazing story about a surprisingly simple but revolutionary treatment that is giving people with RCPD their lives back.
The answer, believe it or not, is botulinum toxin, which everyone knows as Botox. We think of it for wrinkles, but it's actually a powerful medical tool for muscle disorders. When a doctor injects it right into that stubborn cricopharyngeus muscle, it basically paralyzes it just enough, forcing it to finally stand down and relax.
The procedure itself is actually pretty straightforward. The patient is put under general anesthesia. A specialist uses a thin tube with a camera, called an esophagoscope, to go down the throat and get a perfect view of the muscle. They inject the Botox, the muscle relaxes, and for the first time in years, or maybe ever in their life, the trapped gas can finally escape.
And the results? They are absolutely life-changing. I mean, look at this. The success rate is somewhere between 80 and 99%. For the huge majority of patients, a single injection gives them permanent relief. After years of pain and suffering, they can finally burp.
But wait a second. Botox wears off after a few months, right? So how can this be a permanent fix? Well, this is maybe the most fascinating part. The best guess right now is that the Botox acts like a reset button for the nervous system. By forcing the muscle to relax and letting the burp happen, it gives the brain a chance to relearn the right way to do it. It's like the neuromuscular pathway gets retrained, and the body remembers how to burp long after the Botox is gone.
When you step back and think about it, the story of the burp is just this incredible window into the complicated dance between our brain and our gut. It shows how a simple reflex can go wrong, but also how the body can be taught to remember something it forgot. And that leaves us with one last thing to think about. What else does this tell us about the powerful and sometimes really flawed connection between our own mind and body?